I'm looking forward to hearing what Dr. Eddie Jumper, a patient of Boston Scientifics, and he's going to give you a little bit more information from the patient side. I've kind of given you my short spiel about penile implants and erectile dysfunction, and I look forward to hearing more from Dr. Jumper. So thank you for being here.
Thank you, Dr. Anderson, for that really thorough presentation. And I think you were under 25 minutes. You did very, very, very well.
Okay, good.
Very informative. So I hope the guys were really listening because you gave them some really valuable information. As Dr. Anderson said, my name is Eddie Jumper, Dr. Eddie Jumper, and I am not just a healthcare provider, but also a patient of Boston Scientific's penile prosthesis. My story is a little atypical than the normal erectile dysfunction patient story may be, because my issue with erectile dysfunction began, little did I know, in my teenage years. And of course, at that time, I didn't know what was going on. I just knew that my erections were not being sustained for successful intercourse once I became sexually active in my late teenage years. And I really didn't know what was going on. I thought, maybe that was just the norm for my erections and what an erection should feel like and should be. However, as I, matriculated through high school and began college, the symptoms remained. I continued to have erectile issues, so much to the fact that I kind of became very hesitant and almost a little reclusive. And I'm a very outgoing individual, but I was very shy about interactions, dating, because of the fear of not being able to maintain an erection. So my self-confidence was very low at that time. And over time, as I matriculated to college, the issue remained the same. It didn't improve at all. So, it became a little depressing, as can happen with erectile dysfunction. And as Dr. Anderson mentioned in this slide, 40 million men are affected with erectile dysfunction annually. So it's a very common phenomenon among men, but most of us are very, very apprehensive, very shy, very reluctant to talk about it and to seek help. And there's a lot of help out there, but most of us are very embarrassed and very apprehensive, as I said earlier, to seek help, and more importantly, to talk about it with, your spouse, with your girlfriend, your significant other at that time, just for the whole fear and the fact that as men, we're very, or have taught to be, very strong, very masculine, very in charge. So when there's, a deficit that affects us and affects us in a very tangible way, which is our sexuality, which is part of our whole masculinity, or being a man, being able to function sexually, it's very devastating. And for me, it was very devastating because it continued throughout college. And once I graduated from college, I was accepted into medical school and started medical school. And only then did I start to seek some help for the issue. One of my attendings, one of my urological attendings, doing one of my surgical rotations, I just finally got the nerve to go to him and let him know that I was having an issue with erections. And at that time, we did a minor workup and started with PDE5s. And those really weren't working effectively. We then progressed to injections that Dr. Anderson mentioned, or the Trimix, and quite frankly, that really didn't work well for me because the fact that I had to inject myself was just really, really not pleasant. as a healthcare provider, we inject people and draw blood all the time. But when it comes to injecting your own penis, it was just not pleasant and wasn't something I look forward to. I would just break out in sweats and hives when I came to the point of having to inject. So needless to say, that did not work for me. So over time, we just kind of let it be, and I continued uh, matriculating through medical school and not having effective erections, and just kind of, I guess, kind of resolved that this is what it's going to be, moving forward uh, with my sex life. But after finishing graduating from medical school, I started my residency in DC at Howard and in OBGYN, and still didn't really pursue uh, having any further uh, treatment or evaluation until I continued my residency in New York because our program lost their accreditation. So I ended up in New York and finding a position there and continued the residency. And once I was in my third to fourth year, that's when I really seriously started uh, seeking help again. I was in a relationship, so it was like, and the individual that I was involved with, she was like, well, I noticed that your erections are not staying or not successful and, not firm enough for penetration. And maybe you should, seek help for it. So I went to a urologist at NYU who was recommended to me. And we really started a very serious workup, including Doppler studies. And that's when we found out what the problem was. I had a major vascular leak or runoff. So that's why my erections were not being sustained and were not firm enough for successful intercourse because the blood was running out and not staying. It was like a balloon with a hole in it. When it filled up, blood would leak out, so the erections would not sustain. And at that point, I had been dealing with erectile dysfunction now since, well, so since I was in my, probably all of my life. So we're talking now, I was 30. So we had a discussion on the various options. Of course, I had already gone through the PED5s and the injections. So we were now at a point of, I wanted definitive therapy, permanent therapy. Because at that point it's like, okay, I've had enough of this. I deserve to have I'm a young man, and I deserve to have a very, an active sexual life if I choose to. So I basically just told him, I want definitive therapy. I don't want to talk about real anastomosis and any of that. I just want definitive therapy. And the only definitive therapy in 2000 was a penile prosthesis. So we went with that option, and needless to say, I was very pleased. After my initial prosthesis was placed in 2000, needless to say, I guess being devoid of sexual activity for quite some time, I was very active in 2000. So my prosthesis lasted me about 6 years. As you can say, I kind of went a little wild, I guess you can say, just kind of make up for lost time. And with any product, and the more you use it, over time it will wear out. And so in 2006, I needed to have a revision of the penile pump. So it was revised. The old one was removed, and the new one was put in. Another AMS product, Boston Scientific product. At that time, it was just AMS. So another AMS product was put in, and this one, the second one, lasted 10 years. So right before I moved to Florida in 2016, well, right after I moved to Florida in 2016, the second prosthesis started to malfunction after 10 years. So I have since had my third prosthesis placed in 2016, and it is doing and working very well. And I'm very pleased with the Boston Scientific products. And as I have said to them on many occasions, as I've spoken to men over the past couple of years, and at their Everyone Makes a Difference conference in Minnetonka at their headquarters. I had the opportunity to speak there, and to let them know how appreciative I was for this product, because it's really been a game changer for me, as it has, I'm sure, for many men. Uh, and what I say to you, the listening audience, that it's been a game changer for me. But when undergoing and thinking about the various options that are open to you for your various erectile dysfunction issues, definitely always have a very intimate discussion first with, after your doctor, with your partner, of what the options are and what's best for you, because prosthesis, it may not be the best option for everybody. It was for me, and I've been very pleased with it. But after you've given it a lot of thought, and in-depth discussion with your urologist, then make that the best decision for you. But I am a very big fan of it, and highly support it. And if it is a choice that you guys are grappling with, and trying to make a decision, as I said, I'm a very strong advocate for it. It is a life changer. And as Dr. Anderson, mentioned, one of the big things about it, it restores, your self-confidence. It empowers you, because now you have the ability to, not only achieve an erection, but have successful intercourse anytime you want, because the pump is under your control. You pump it up, you inflate and deflate, at your leisure, and it stays erect for as long as you like it to. So it's a very, creative device, but a very fulfilling one, and it has been for me personally. And I'm just very grateful to Boston Scientific, and also thank you, Kelly, for the opportunity to speak to your audience, and to these men, with my personal story. And I hope it's been beneficial to them, and will help some of you to make a decision as you move forward in your journey. And thank you again, Kelly, and thanks to Boston Scientific and Dr. Anderson. It was a pleasure being a part of this Zoom.